Welcome back to OpenLine. We are talking about children in Tennessee and how they are doing. A new study is out, the Kids Count study that comes out every year, really kind of going through several very important categories about how we are doing caring for children in Tennessee. As we went to the break, we went over 3 of the 4 categories in which we kind of judged how we're doing. And we have Linda O'Neill with us with the Tennessee Commission on Children and Youth. The last category, family and community, we ranked 39th out of the 50 states. What's going on there?
So the part of the challenges in family and community, 2 of the measures are about single parent families, and more than 1 in 3 children in Tennessee lives in a single parent family. And one of the other measures is about children who live in high poverty neighborhoods. And in Tennessee, 1 in 6 children lives in a high poverty neighborhood. And on both those indicators, they are worse than the baseline. And I think one of the things that's important about the data in this report is it really compares where we were in Tennessee in 2008, which was before the Great Recession hit, and where we are now. And it really hit in Tennessee starting around 2009, where we are now 8 years later, and it shows how much we're struggling on those economic-related indicators to improve outcomes for children.
That is interesting, because you kept mentioning 2008, but this report comes out every year. So what you're comparing to is the Great Recession. In 2008, we were doing okay, I guess. It was certainly before the Great Recession. We still have not recovered,
right,
is what this indicates.
That's right.
And economically and in other ways, but especially economically.
Especially economically. And one of the things in the family and community, one of the other categories is adolescent births. And we've seen substantial improvement in that in Tennessee. And nationally, teen births are actually at historic lows. And that's really good news. It's good news we've made a lot of progress in Tennessee. The bad news is that we're still 42nd nationally. So we have a lot more room for progress in that area. And we know there are a lot of things that can help reduce adolescent births, and that really expectations on the part of young women that they have a future other than just having a baby is an important part, that they have opportunities for college, for careers, for understanding why it's important to delay childbearing until they're really in a stable, committed relationship, and until preferably married, and until they really can support a child. We also know that the birth outcomes are worse for adolescents because their bodies aren't really fully developed and ready to be producing another child. So you have more of the low birth weight babies, which again is the only category we rank worse than teen births is low birth weight babies, and also higher instances of children who subsequently have disabilities, either related to the low birth weight babies or other factors.
Is Tennessee unusual when you compare us to other states, if you're able, in that we haven't fully recovered from the 2008 recession, or are other states facing the same situation?
Other states are facing the same situation. Nationally, the recovery has been very uneven, and that's why you see so much in the political arena around the issues of middle class, and people have been dropping out of the middle class really because of the uneven recovery. And so much of the benefits of recovery have gone to the wealthiest individuals.
So what do we do? So economic well-being, family and community, those are the 2 areas we really need to focus on. 1 out of 3 children live in a family where the head of the household doesn't have a stable job. 1 out of 4, or more than 1 out of 4, lives in poverty. Yes. What do we do? How do we change that?
So I think there's some things that are going on in Tennessee that over time will change that. Unfortunately, there's not really a quick fix, but some of the strategies that should improve, it's really very much tied to economic development, availability of jobs, include things like Tennessee Promise and the Hope Scholarships that give better expectations, especially for low-income young people, that they can go to college or that they can go to career school, and that they can really develop the skills they need to have better paying jobs that actually support a family.
And I was seeing tonight another story about drugs, opiate abuse, that kind of thing. It's a huge problem. Is that indicated in some way in the data that you have collected?
This data does include kind of what I referred to earlier as an environment where adolescents are making better choices, in that the percent of adolescents who report abusing alcohol or drugs has actually declined since 2008. But we know in Tennessee we have huge problems with opioid addiction, with substance abuse across the board. We have a huge problem with neonatal abstinence syndrome, which are babies who are born addicted, and that contributes to the low birth weight babies. We have to, in this state, figure out a way to better address the opioid and other substance abuse problems. But these aren't necessarily problems for the children themselves. They're the problems of parents, but they have a significant impact on the children, on the parents' ability to parent them, and they really have intergenerational impacts. Children who don't have good parents are not necessarily likely to be effective parents themselves. And I think most people want to be good parents. I've never really met anyone who just did not want to be a good parent, but so many parents don't have the skills, the knowledge they need. They perhaps didn't have the kind of parenting that would help them develop those skills. But there are interventions or services, supports that can make a difference. One of those is quality home visiting. And in Tennessee, we have several different evidence-based quality home visiting programs, and these are when trained home visitors, starting often before a baby's even born, work with women who are pregnant and their partners or spouses, and also work with the new moms to help them really know what are reasonable expectations for this baby. How important is it that you help this child have a good start in life, that you know what gets referred to as serve and return, that you talk back and forth to the baby, you help the baby develop language skills. I mean, babies are born learning from virtually from day one, but people often don't really realize how important the early years are that make so much difference in the child's developing brain. That serve and return interaction, the language development, the safe, stable, nurturing environments are so important to break those cycles of things like substance abuse. Mothers who have severe maternal depression are challenged to be able to provide that level of support and serve and return. But that's treatable, and most women will recover from that. But not if they're just left without any services and supports.
And there's definite literature that I was reading talking about the effect of stress.
Yes.
Toxic. It's a toxic effect. And if a child's growing up in a home where there's an addicted parent, or a child's growing up in a home where there's not enough money, or the family, there's no job, there's enormous stress in that household. And it's more than just makes them unhappy. This has real consequences. Right. Is that right?
It has real consequences that are measurable, and science is really clear now about the impact of different levels of stress. I mean, there's normal stress that we all have. It's a little stressful to me to come and be on television because that's not what I normally do every day. But that's okay. And there's what gets referred to as tolerable stress that can be pretty acute stress. But when you've got, it's often a major accident or the death of a loved one or some of those kind of things, or even divorce and some of the other things that are really challenging. But if there are safe, stable, nurturing relationships that kind of wrap support around that child, then it's not going to have the same impact as what gets called toxic stress. And that's when there's repeated exposure to things like different kinds of abuse and neglect, to the family dysfunction of domestic violence and parental incarceration and parental substance abuse or parental mental illness or single parent families, divorce. And all those things are often interrelated too. The original studies around the impact of adverse childhood experiences focused only on the 5 types of abuse and those 5 family dysfunctions I just mentioned. But increasingly, the research validates that poverty, that community violence, bullying, institutional racism, other kind of factors also present toxic stress. And it basically results in releasing chemicals in the child's brain that put them persistently on a fight, flight, fight or freeze mode of operation, and you can even see it in the cortisol measures in their brains, because for all of us, when you get up in the morning, your cortisol goes up and then it goes down over the day. When you have tolerable stress, it goes up, stays up a while, and then goes down a little bit. But children and people who have had serious toxic stress, their cortisol levels go up and they stay up. They never go down. So there really are clear physiological impacts that disrupt the architecture of the developing brain and really provide a weak foundation that makes it harder for the child to succeed in school and in life. These kinds of experiences clearly contribute to adult health problems, including diabetes, heart disease, hypertension, all kinds of inflammation, and they even show early death when there's a lot of them.
I'm fascinated by that. You can medically sort of measure the impact of the stress on children, this oppressive sort of stress that is there when you're just surrounded by some of these problems that are outlined in the report. All right, we're going to take a break. If you want to call in, there's the number 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.